So at first I'd like to start off with some questions with regards to your profession.
Okay.
So first of all, would be, which specific area of social work do you practice in, and how long have you been in this field?
Well, I'm primarily offering family and marital counseling or family and marital therapy, and I've been practicing for the last about 25 years.
Okay, it's very long indeed.
Quite long.
So based on your experience, so what do you feel are the more common issues that crop up in this setting?
With counseling couples and families?
Yeah, the one that you are working in.
Well, I guess one big challenge is always having the clients who come having the same idea of that they need help, because usually one person feels more needy of help than the others.
Mm-hmm.
And having the clients who come having the same idea as to what is the reason why they are experiencing the difficulties.
Okay.
Oftentimes there's a bit of a blame going on.
Okay.
Maybe the wife blaming the husband or the father
Mm-hmm.
blaming the son.
Okay. So usually what kind of certain like issue do they usually come up with?
Okay. Well, because couple and family work tends to be quite broad.
Mm-hmm. That's right.
We cover anything from marital choice,
Okay.
deciding if I should I marry this person, to having difficulties with the relationship. Sometimes it revolves around money, communications, intimacy. Sometimes it revolves around conflicts over specific issues.
Mm-hmm.
And in that sense, sometimes it may go into something more extreme like violence in the marriage, violence in the home. And the other tail end would be, should I stay married or should I leave the marriage? You know, so the whole spectrum.
Okay, there's a lot of things that you cover.
Yeah, and of course with family counseling, it's also the whole age spectrum to should we have children, why can't we have children, how to raise children, what to do when the children don't seem to want to listen to you, and what to do with ourselves now that the children are old enough and we may feel quite redundant.
Okay, so it's over a long period of time actually.
Yeah.
So from young all the way to old.
Right.
Okay.
So in that sense, it's good to keep a developmental perspective on your work. So what's covered in the individual, in the family life cycle development, that serves as a very useful backdrop.
So can I say that that's the main skill that you usually use, or is there any other like skills that you usually incorporate?
It's one of the theoretical models that we remember, you know, to make use of. But in terms of the skills, the counseling skills, it'll be quite a different set.
Okay.
Then you're thinking of how to engage clients, how to bring about changes.
Yeah, that will be my next question. So how do you go about engaging these clients?
Well, I think we need to keep in mind that counseling is usually the option of last resort by clients.
Okay.
They are usually feeling very embarrassed. They experience a lot of maybe shame about coming for help. Maybe even feeling awkward about talking about something so personal to a stranger. So when other couples or individuals come in, one of the important things is to engage them, to feel safe, to feel that they can trust you, a complete stranger, you know, to feel ready to talk about their difficulties, to not feel like they are going to be judged. So that's really one of the big challenges, how to engage them.
Okay. Alright. So so in your opinion, how I'm assuming that from what you said, you feel that will you say that the beginning stage is the most important part for the whole relationship, since you talk about trust?
Well, I guess since this interview is about the beginning stage, it is an important. It is one of the most important. I think every stage in the interview, in the session is important. But if you can't even clear the beginning, then you have a big challenge. You know, it's too hypothetical then to talk about what is the problem, how to do the treatment process.
Okay. Alright, thank you. Okay, so again from your experience, what do you feel are the more common mistakes that social workers usually make during the beginning stage?
Oh, we make lots of mistakes. and that's quite understandable because it's not a very straightforward process. One of the mistakes, as I said, or I alluded to, is the fact that you assume that the clients, especially when you're seeing a number, all have the same idea as to, is there a problem? If there is, what is the problem? Whose problem is it? How do we fix it? Just these 4 areas. If we don't check out our assumptions and whether there's consensus amongst those who have come, that can be a big error. Yeah. And then I think the other error is, sometimes not knowing if the clients are ready to work or not. Because sometimes they may talk about a difficulty, but it's one thing to say, I'm uncomfortable with a problem. But it may be a totally different matter to say, I want to do something about it. Or I'm ready to work on it. I'm ready to make the adjustments, the difficult decisions that may be necessary. Yeah. So we assume that, and to our downfall.
Okay. Okay. Lastly, just last question. Do you have any invaluable advices for the future social workers, especially those who are intending to work in your setting?
I guess the good part of our work, especially in this setting, is the fact that you're dealing with a topic that we all can identify with. We all come from families, we all experience family relationships, whether good or bad ones, positive or negative ones. So if we keep our eyes open, we can actually learn a lot that we can bring into our work, and vice versa. But I guess on the note about advice, this is a field that you keep on learning, and there'll be new things that will be discovered, new ideas, new formulations that will be coming forward. And I guess because we are in Asia and we tend to be at the receiving end of ideas coming from the West, it's good to learn, it's good to question what you read, what you are taught, to see how applicable it is. Because we are now more aware of our identity as Asians, as people with perhaps different sets of ideas, different perspectives. So if we keep a questioning and open mind and learning mind, I think that will help you or help anyone in the profession that they are choosing for themselves.
Right. Thank you very much, sir. We really appreciate your time. So yeah, this will really help us.